my name is Dr. Bridget Williams. As Lisa introduced me there, I am the owner of Green Harvest Health. We are a medical cannabis and integrative clinic. So we believe in the power of cannabis, in doing education, in empowering the patient, and being empathetic to the patient's needs. So we provide services that specify and focus on life coaching. We have IV hydration. We have an integrative clinic, a full integrative clinic in our Cleveland office. So we believe in what cannabis can do when it's supported, and that you have a full wellness toolkit. So that's a really important part of holistic medicine. So I'm excited about that. We just launched our book, which is called Courage in Cannabis, where we have people where cannabis has changed their life. And they share their story to be inspirational as well as educational. And I spend a great deal of my time traveling and doing talks around the country. And I consider it to be medical motivational talks. Giving you the information that you need, but hopefully to motivate you to change is really what it's all about. So very excited to be here. So today is about breast cancer imbalance. And keep in mind that this isn't just about cancer itself. It's really about the philosophy about how you live. So we'll use some aspects of breast cancer, and I'll give you some information and everything to chew on. But this is really about how we live as women and how we need to make ourselves a priority and really focus on loving yourself, right? So I want to take actually an excerpt from, I don't know how to do that, the Courage in Cannabis book. One of our amazing authors, Mary Jane Borden, and that is her real name, shared her story of breast cancer. And I want to be able to share that with you. And I think it really drives home what cannabis can do and really how it can change lives. So, Mary Jane, you have breast cancer, said the surgical oncologist. The mammogram showed a malignant lump. Her assistant added, "It is triple negative. Chemo is your treatment option." She was stunned. So survival depended on her immunity. And what do anti-cancer drugs do? They suppress the immune system. So she decided to go down a road less traveled. She states, I underwent surgery and radiation. I substituted cannabis for chemo, specifically Rick Simpson oil. The RSO, the Rick Simpson oil, worked well. Not only did the tumor disappear prior to surgery, but the surgical team listed cannabis in my discharge orders as a mandatory medicine. And far from where we were 5-10 years ago, without a doubt. So the surgical team listed cannabis in my discharge orders as a mandatory medicine. Given the severity of cancer, this was the best possible outcome. I recovered quickly and raked leaves 1 week later. I had 0 symptoms, little pain, and no apparent side effects. 1 year later, the cancer is still gone. My immune system is intact. My health is good, and I evaded COVID-19. Mary Jane's story is really powerful because it's a very scary time to really consider when you get that diagnosis and what will you do. To be able to, Mary Jane is definitely an amazing person because she has a background where she knew a lot about chemotherapy drugs and worked in labs. So she had to make a decision that worked for her. And as a physician, I cannot say do not do typical treatments, but I worked with her during this process, and it was an amazing, amazing process to watch and see her heal and see her use what she has worked so hard to make legal in Ohio, because Mary Jane is a strong advocate and activist in the state. But to see what she worked so hard for in Ohio to bring cannabis to legalization, and we have a medical program, to see it work for her own health. So really amazing story. So breast cancer became one of the most common cancers globally in 2021. It's accounting for 12% of all new annual cancer cases worldwide, according to the World Health Organization. In women under 45, breast cancer is more common in Black women than white women. Every 2 minutes, a woman is diagnosed with breast cancer in the United States. So consider if this feels far from your experience, you undoubtedly know or will know a woman with breast cancer. If the disease is caught early, women with breast cancer have a survival rate of an astounding 99%. And that is really due to the work and research that we've done over the last 30, 40 years, to be honest. Though that may dip down to 28% if the cancer has spread. So, of course, we're familiar with the treatment options. Surgery, um, we're operating, and the doctors actually cut the cancer out and potentially lead to mastectomies and all of the emotional and difficulty that goes with that. Chemotherapy, where we're using special medications and most times described as toxins to shrink or kill the cancer cells. Unfortunately, it's killing your other cells as well. Hormonal therapies, which blocks cancer cells from getting the hormones they need to grow. Biological therapy or immunotherapy, where we're using our own immune system to kill the cancer, and radiation therapy as well. Keep in mind, I'm not anti traditional medications by any means or procedures, but I do believe in individualized medicine and being able to provide options for people that work for them and they feel respected in their choices along the way. So, where does cannabis really fit into this? As shared with the expert from Mary Jane's Borden's story, she chose cannabis as an option. And by the time that she was done with this whole thing, her hospital, her medical team viewed cannabis as a necessary and mandatory medication on her medication list. Years ago, we couldn't even imagine cannabis, marijuana being listed as one of your drugs. So, really, we have, as much as we have more to do, and keep in mind, every state is a little bit different. Um, there have been some really remarkable changes in the last 20 years. So keep in mind that cannabis is not only something that we look at for treatment, which I shared for Mary Jane's story, but also it's so incredibly helpful for side effects as well. In an online anonymous survey of more than 600 adults with breast cancer diagnosis, 42% reported using some form of cannabis for relief of symptoms such as nausea, vomiting, pain, insomnia, anxiety, and stress, according to the publication Cancer. But keep in mind, according to the Department of Labor, women make 80% of household medical decisions. So whether it's for themselves, for their children, their spouses, sometimes their parents, and even their siblings, women are the ones that are really making these decisions. And women are choosing cannabis as an option. So consider, can CBD be an option for you? It can. CBD in cells are found that it actually can suppress the estrogen production directly by inhibiting an enzyme that makes it from testosterone. I have patients that are either in the midst of their treatment or actually on the other side of that and use CBD regularly as a way to keep the cancer away. Can THC help? Absolutely. It's been found to inhibit the proliferation of the estrogen receptor positive breast cancer cells and is also beneficial in the side effects, just like CBD. Another finding, and Sasha shared this in her segment, was CBDA, which inhibits the migration of highly invasive human breast cancer cells and can also help with the side effects as well, such as nausea. So if you're in this situation, then what do you choose, right? You can pick and choose cannabinoids one by one, or you can do what Mary Jane chose, and she decided to go with a Rick Simpson or FICO, a full extract cannabis oil, to be able to get all these really cannabinoid rich aspects of the cannabis plant and to utilize this as her treatment. In her case, we did a typical Rick Simpson protocol. But what we found how difficult it was, particularly in the state of Ohio, to be able to get the amount that she needs as a cancer patient to complete the protocol, and to be able to get a good supply of it on a regular basis. Keep in mind that when we can look at this and is cannabis helpful and should we use it, should we not use it? There are pharmaceutical cannabinoid medications. You're familiar with Epidiolex that we have been, which is actually from cannabis, and we're using that for seizure disorders. But there's Marinol, Syndrose, Sesamet, all being used for nausea and vomiting, specifically for the use of nausea or vomiting around cancer. So when the question comes up, is does cannabis have medicinal value? It's already FDA approved in other forms. So there's no question really, is there value there? Does it help? It's about getting the information and getting the freedom to be able to use this in different ways. So what is more important than all of this? As I said, that this isn't just about breast cancer. This isn't just about where cannabis fits in for a cancer regimen. This is really about self love. And I love the fact that this isn't just a Valentine's theme. This is really a self love theme. And by the way, apparently there is a self love holiday, which is tomorrow. So happy self love day tomorrow. Um, and I think the important part of this is this goes way beyond bath bombs and perfume, right? This is about taking care of yourself, taking the time to take care of yourself. So, number one, based on what we're talking about today, get your mammogram. I know we all hate it. Find someone that loves it. Nobody loves it. But the recommendations have changed over the years. They want women at age 50 to really start getting their mammograms. If you are more high risk or have more issues, you might be getting it at age 40. And in other cases, talk to your doctor because there's also recommendations to possibly get it as early in your 30s. So don't ignore that. Don't sit and wait and assume I haven't gotten to that age yet. Know your family history. Do your self breast exams. Meet with your doctor and make a decision that's specifically meant for you, not necessarily just based on the preventive guidelines, which are there for a reason, but make sure you're making the decision that is right for you and your body and your family history, so that you're not surprised in the long run. And speak early to your physician. Don't wait and later on and say, oh, I'm getting to that age. Start having some of these talks early. Self love is also doing the research and getting support about what treatment would be right for you. Like I said, we are great at helping others, but how great are we at helping ourselves? So the story I share with Mary Jane, for her, it was absolutely no way that she could do chemotherapy as far as she was concerned. And I walked with her during this walk to look at what her family, what her doctors are saying, really help supporting her because there was no budging. She knew too much. But make sure that you're making the right decision for you. That's not necessarily the right decision for everyone. But get the support that you need so that you're making an informed decision and not a fearful decision. But self love is also silence. I feel like we're hustling and bustling and moving, and rarely do we have that time of stillness and silence, whether that is meditation for you or whether that is simply sitting. No activity, no thought, just being in the space, being still within your own body. Do what you need to do to decrease your stress. I think, particularly for American culture, stress is kind of just something we always put on our plate. And if it's not there, it's considered what type of diet are you on, right? Consider what you can do to decrease your stress, and don't be afraid to engage other people to help you do that. Partly, let's think about how we eat. The American diet that we see on TV, that's provided for us, that's out there, doesn't mean that's the diet that we need to eat. Make a decision that's based on your body and what's good for you. Get more omega 369 fatty acids. Get those hemp seeds in there. The beauty of the cannabis plant is not just the cannabinoids, but there's also so much fiber and protein and help that you can get just from the hemp seeds themselves. Treat your body well. And if you don't want the toxins of the chemo, be careful with your alcohol consumption, because that's basically a toxin as well. Eat a diet that is rich in grains and vegetables and fruits and beans. And if you don't like those, start trying to figure out how you can create a relationship with them. I always say there's a vegetable for everyone. You just have to do the research. Limit your fast foods. Society tells us this is, we grew into an age where this was the standard, and the standard isn't always great for everyone. Limit your red meats and your processed meats, and limit the sugar and sweetened drinks in your diet. But overall, relax and rejuvenate. Although there's no evidence that strong evidence that says that stress is directly affected to cancer outcomes, it is said that excessive levels of stress hormones promote carcinogenesis by inducing DNA damage accumulation. Protect yourself naturally. Decrease your stress. As women, we're phenomenal, again, at taking care of others, so take care of you. Do not be afraid of when the universe tells you it's time for change. Do not live in fear of the unknown. You're magnificently strong, and the reward is your own authenticity. Find your own cannabis story and learn how it can not only heal your body, but also heal your mind. And live and love and get your mammogram.